Jennifer West here with Fur Baby Doc. We are covering vaccine reactions today. I just had clients come in the other night who had a 3-year-old dog who received boosters of vaccines and had a significant vaccine reaction. What they noted at home was their dog was becoming more and more agitated, getting up a lot, kind of pacing around the room, was grooming himself excessively. And then when they turned on the lights and realized his cheeks were very swollen, he kind of had more of a puppy face than usual because his cheeks were nice and swollen, and around his eyes were also swollen. This dog did not start scratching at its face, but that sometimes can also happen. And this dog did not, but some dogs develop hives. Those can be a little hard to see in a dog due to their coat, but in shorter fur coats, you may see little bumps. And if you feel it, of course, you'll feel those hives, those bumps, just like chickenpox feeling. Now, when they came in, they expressed to me they were concerned because their dog had never had a vaccine reaction before, and this was, the third or fourth time the dog had been vaccinated. The reality is that's not uncommon. I hear that all the time, and it scientifically makes a lot of sense. So I want to help explain to people why this may be and ways to prevent this happening to your pet, as well as, if it has already happened, to go forward with reduced risk. Now, as an emergency veterinarian, I do not vaccinate a lot of pets. I administer rabies vaccines in cases where a bite occurred, and we want to make sure they're boosted. But other than that, I do treat a lot of vaccine reactions. So once it becomes the emergency, I'm there. Now, the majority of vaccine reactions are not that severe. They'll have the symptoms I already described, and typically, at that point, treatment's initiated and they improve quite well. But some can proceed to breathing difficulty. Just due to all the swelling around their face and neck, it can start causing trouble for them breathing and be, of course, a much bigger emergency. When a dog has this reaction, treatment is primarily with antihistamines, so things like Benadryl. And at the veterinary hospital, we have the ability to administer an injectable form, so it works much quicker and is more effective. Some patients may also need steroids if it has become more severe. At home, for the next couple of days after that severe reaction, you may need to continue the Benadryl, but speak with your veterinarian about if that is appropriate for your pet or not. Why does this happen? A vaccine reaction is not because the vaccine was bad. It's not because your pet is, has a bad immune system or something. Quite the contrary. Your pet's immune system is a little bit over-responsive to that stimulus. When we give a vaccine, the goal is to introduce the body to a tiny, either dead or modified source of the scary condition we're trying to prevent. So rabies, distemper, parvovirus, Lyme disease, leptospirosis, the list goes on, Bordetella. And the way to do this is we introduce a tiny little bit of that condition in a way that the body won't actually get infected by it. So it's a safe way to introduce it that allows the body to prepare a little bit of an antibody and immune response to fight it off if the body is ever actually introduced to that condition. Now, the body may think that it is actually being introduced to that pathogen, and it may mount an inappropriately aggressive response. Or a pet may truly be allergic to a component of that vaccine. So there are other components of vaccines to just keep them stable, to make sure that they remain viable for the intended course of time before it's administered. And some pets are actually allergic to that as well. So a vaccine reaction is an allergic response for whatever, for one of those reasons. And with any allergic response, it will be worse each consecutive time a pet is introduced to the stimulus. The body will create antibodies that recognize quickly that stimulus and fight it. And so the body mounts a lot of inflammation and tries to fight it. They may become lethargic, they'll become swollen, they may develop hives, they may become have an increased temperature. They may also develop belly upset, and that's because the stomach has a lot of histamine receptors and release with the response to an allergen. So the histamine is increased throughout the body all that swelling occurs, and they may develop increased stomach acidity and vomiting as well. So sometimes antacids are prescribed in addition or recommended in addition to the Benadryl. So I hope that helps clarify some of the scary concerns with vaccines. Vaccines are of course recommended with rare exceptions. Always talk to your veterinarian if your pet is older, if it has had past vaccine reactions. Ways to prevent a recurrence of a vaccine reaction may include spacing them out. So rather than getting your distemper, parvovirus, Bordetella Lyme, lepto, rabies vaccines all on the same day, we might recommend coming in for a couple of appointments and spacing those out so that the body has time to mount responses that are much smaller, less aggressive, and less traumatic for the body. Additionally, if your pet is older or has other concurrent illnesses, then your veterinarian may say, you know what, there's a very low risk of your pet contracting Bordetella. They don't go to boarding facilities, or you know, this dog doesn't live in an area with a lot of ticks and doesn't go outside a lot, so Lyme disease is less of a concern. And so that's always important too, to have those discussions with your veterinarian about your personal pet and make sure that you're pursuing the best preventative health and doing everything you can to prevent these diseases and also vaccine reactions. If you are ever in doubt of what's going on, always take pictures, take videos at home, send them to your vet, but going in sooner than later is always best. With emergency medicine, the quicker you're seen early in a concern, the better. This is Jennifer West with Fur Baby Doc. I hope you guys have a great day.